The whole story of RAS testing in colorectal cancer is a perfect illustration of the development of personalized medicine. Initially, patients treated with monoclonal antibodies against EGFR were unselected. Then, based on preclinical data and early phase analysis, it was noticed that KRAS exon 2 mutations might confer resistance to those antibodies, and retrospective analysis were performed from larger phase 2 and phase 3 trials. And then it developed into more retrospective, prospective studies, phase 3, with the use of these antibodies in first and second line metastatic colorectal cancer. And this established the concept of KRAS exon 2 mutation would confer resistance to these drugs, and the patient population to be treated should be KRAS exon 2 wild type patients. But then, going deeper into the RAS family of oncogene, it was noticed that some other members of the family may harbor mutations. So, from the initial tumor samples from large studies, additional search were made to look for this less frequent mutation. And it turned out that within the initial KRAS exon 2 wild type, it was shown that about 15 to 20% of those patients actually had an other RAS mutation. And it was also demonstrated that this less frequent RAS mutation on NRAS, exon 2, 3, and 4, and KRAS exon 3 and 4 were conferring a similar resistance to treatment. So this led to an enrichment of the patient population to be treated, associated with an increase in the benefit-risk ratio. The usual sequencing methods, like the Sanger technology that was used before, is now progressively replaced by the new generation of sequences. The consequence of that is that we can test several genes, not only the RAS, but we, in most of the cases, find more mutation, meaning that fewer patients would be actually eligible for treatment with anti-EGFR. We don't know exactly what the impact of this less frequent mutation is. Do they confer a similar resistance to the other one? That we don't know, but further study will have to be performed in order to establish. So this is overall a story that is almost 10 years old. So it took time, but we are more and more refining the patient population to apply this concept of personalized medicine in metastatic colorectal cancer.